We are Healthcare Partners of Nevada. We promise to earn and keep your trust.
We promise to treat you like family.
We promise.
We promise.
We promise to be an important part of the community.
We are Healthcare Partners of Nevada.
We're Healthcare Partners of Nevada.
We are Healthcare Partners of Nevada.
Contact us today to learn more about our promise to patients and to find out how you can see a Healthcare Partners doctor.
Dry eye is really a misnomer because most of our dry eye patients complain of excessive watering, and that is not unusual at all. What we have to remember is that we have two types of tears. We have the lubricating tears and the irrigating tears. And when the lubricating tears are not sufficient, then the eye will automatically use the irrigating tears, which will cause the excessive watering. The best way to find out whether it is truly dry eye or an infection or something else is come in and get your eyes examined. We will be able to diagnose that by doing a slit lamp exam on you and using some different kinds of drops to interact with the tears and see if you have lots of tears. People who have dry eye complain not only of the excessive watering, but sometimes they complain of itching, burning, scratchiness, blurry vision. All of those things can be caused by dry eye. And there are some treatments for it that are very, very good, and that's why it's a good idea to come in and have your eyes examined if you suspect that you have dry eye. Definitely dry eyes. Number one, the environment. In southern Nevada, it is perfect for dry eye because we have a very low humidity, and you know the tear film is very, very thin, so it doesn't take much for it to evaporate in this. Also, the dust and the pollution, other pollutions in the air will cause the person to have dry eye. As we grow older, we produce fewer tears, and naturally the eyes become a little drier also. Medications can do it, especially medications for allergies and over-the-counter allergies, especially. Over-the-counter drops or medications for allergies will cause the eyes to dry out. And definitely makeup can cause it, especially when you put it along the, I think it's the eyeliner that goes right along the lid margins, because a lot of the glands that produce the lubricating tears exit. The duct exits right along the tear margin, the lid margin, so that when you put the eyeliner on it, you clog them up and the tears can't get out.
What type of treatment do you have for dry eye?
We usually start off with artificial tears, and that is an over-the-counter preparation, and if that doesn't work, especially if you have to use it too often, I'd like to see a person use it no more than 3 or 4 times a day. If you have to use it more often than that, then we can go to some prescription medications, and one that we think of, maybe we've seen on TV advertised as Restasis. It works very, very well. There are some others all the way up to doing contact lenses that will help keep the eyes a little bit more moist as well.
And so people can make an appointment right here at your office here on Calvada. What's the phone number?
Definitely. Our telephone number is 775-727-8300.